really is designed for patients who are sort of in terminal dentition, meaning that none of their teeth really are salvageable. I think as dentists, we're always trying to save teeth if we can, but there is an end point. And beyond that point where it's not worth trying to salvage those teeth anymore, then you're looking at something like dentures. So dentures are the conventional way to replace missing teeth, but those come with some big inherent problems, mainly fit and aesthetics. A lot of people, they don't fit well, they don't look that great, and they also have this tendency to get more loose over time and then have problems falling out constantly. With the advent of dental implants, we are now able to strategically place dental implants across the arch and stabilize these hybrid-looking dentures to the upper and lower arch so that they are essentially permanent. They don't come in, you don't put them in, you don't take them out. From a functional standpoint, because they're bone supported, they provide a lot of chewing force, almost like natural teeth. And then from a comfort standpoint, because they don't cover the entire roof of the mouth, or they're not as long or as bulky as conventional dentures, they're much more comfortable for patients to wear.